A patient with chronic GERD is found to have salmon pink mucosa on endoscopy. What is the diagnosis and standard management? Barrett's esophagus. Manage with daily PPI therapy and surveillance endoscopies every 3 to 5 years if no dysplasia is present. What is the most accurate non-invasive test to confirm eradication of a documented Helicobacter pylori infection? The urea breath test or stool antigen test, performed at least 4 weeks after completing antibiotic therapy and 2 weeks after stopping PPIs. A patient presents with RUQ pain, fever, and jaundice. What is the diagnosis, and what imaging test should be ordered first? Acute cholangitis, Charcot's triad. Order a right upper quadrant ultrasound first. Treatment requires urgent ERCP biliary decompression. What is the most specific laboratory indicator for diagnosing acute pancreatitis? A serum lipase level that is at least 3 times the upper limit of normal. Lipase is more specific and remains elevated longer than amylase. What is the preferred initial serologic screening test for a patient with suspected celiac disease? Serum tissue transglutaminase, TTG, IgA antibody combined with a total serum IgA level to rule out IgA deficiency. Which IBD is characterized by transmural inflammation, skip lesions, perianal fistulas, and non-caseating granulomas? Crohn's disease. Ulcerative colitis is limited to mucosa/submucosa, continuous from rectum, and features crypt abscesses. What is the first-line oral antibiotic therapy for a patient with a severe initial episode of Clostridioides difficile infection? Oral fidaxomicin or oral vancomycin. Metronidazole is no longer preferred for initial episodes. At what age does the USPSTF recommend beginning routine colorectal cancer screening for average-risk adults? Age 45. Screening should continue through age 75. A patient's screening colonoscopy reveals 3 non-pedunculated tubular adenomas measuring 6 millimeters. When should they return for a repeat colonoscopy? In 5 to 10 years, depending on the exact pathology and quality of the bowel prep, classified as low-risk adenomas. What is a serologic profile showing positive hepatitis B surface antibody, anti-HBs, and negative core antibody, anti-HBC indicate? Immunity due to hepatitis B vaccination. Natural infection immunity would feature a positive anti-HBC. What is the standard screening protocol for hepatocellular carcinoma, HCC, in a patient with documented cirrhosis? Abdominal ultrasound every 6 months, with or without serum alpha-fetoprotein, AFP, measurement. What medication is used first-line to decrease ammonia levels in a cirrhotic patient presenting with hepatic encephalopathy? Lactulose. Titrate to achieve 2 to 3 soft stools per day. Add rifaximin if symptoms recur despite lactulose. A patient presents with acute, excruciating perianal pain and a palpable, purple, exquisitely tender nodule at the anal verge. What is the management if presenting within 72 hours? Thrombosed external hemorrhoid. Treat with a local excision under local anesthesia in the office. An older patient with a history of atrial fibrillation presents with sudden, severe abdominal pain out of proportion to physical exam findings. What is the diagnosis? Acute mesenteric ischemia. Order an immediate CT angiography of the abdomen and pelvis. A 28-year-old female presents with chronic, cramping abdominal pain that improves with defecation, accompanied by alternating diarrhea and constipation. Labs and CRP are normal. What is the diagnosis? Irritable bowel syndrome, IBS. Manage with dietary modifications, low FODMAP, and symptom-targeted pharmacology.